When the heart suddenly stops pumping effectively, the patient can die within minutes. And during sudden cardiac arrest, the AED becomes one of the most important tools in EMS because early CPR and early defibrillation save lives. In this video, we're breaking down sudden cardiac arrest, how AEDs work, shockable versus non-shockable rhythms, and the biggest mistakes EMT students make during resuscitation. Let's get into it. Cardiac arrest occurs when the heart suddenly stops pumping blood effectively. That means circulation stops, oxygen delivery stops, and the brain and organs immediately begin suffering from lack of perfusion. Without intervention, death occurs quickly. Now, here's something important. Cardiac arrest is not the same thing as a heart attack. A heart attack is a circulation problem to the heart muscle. Cardiac arrest is an electrical and pumping failure problem, but heart attacks can lead to cardiac arrest. Cardiac arrest patients are typically unresponsive, not breathing normally, and pulseless. And remember, agonal gasps are not normal breathing. Agonal respirations may occur early in cardiac arrest, but they are ineffective. If the patient is unresponsive, pulseless, and only gasping, begin CPR immediately. CPR manually pumps blood through the body. Chest compressions help circulate oxygen, maintain minimal perfusion, and buy time until defibrillation and advanced care occur. High-quality CPR is one of the most important parts of cardiac arrest management because without circulation, defibrillation becomes less effective. AED stands for Automated External Defibrillator. The AED analyzes the heart's electrical activity and determines whether a shock is advised. Now, this is critical. The AED does not restart the heart. The shock temporarily stops chaotic electrical activity. That gives the heart a chance to reset into an organized rhythm. The two major shockable rhythms EMT students should know are ventricular fibrillation and pulseless ventricular tachycardia. Ventricular fibrillation, or VFib, is chaotic, disorganized electrical activity. The heart quivers instead of pumping. Pulseless ventricular tachycardia is a rapid rhythm that prevents effective circulation. These rhythms may respond to defibrillation. Now let's talk about non-shockable rhythms. These include asystole and pulseless electrical activity, or PEA. Asystole is essentially a flat line. PEA means electrical activity exists, but the heart is not producing effective mechanical contractions. And here's the key. The AED will not advise a shock for these rhythms. CPR must continue. Now let's walk through the basic AED process. First, confirm unresponsiveness, absent pulse, and abnormal breathing. Then begin CPR, power on the AED, expose the chest, and apply the pads. One pad goes upper right chest, the other left lateral chest below the armpit. Then follow the AED prompts. And this is very important. During rhythm analysis, nobody should touch the patient. If the AED advises a shock, clear the patient completely. Visually confirm nobody is touching the patient, the stretcher, or equipment connected to them. Then deliver the shock. Immediately resume CPR afterward. Do not waste time checking pulses for long periods. Minimize interruptions. Biggest mistakes EMT students make. Number 1, interrupting compressions too long. Number 2, forgetting scene control during shocks. Number 3, delaying AED application. And number 4, focusing more on the monitor than CPR quality. Remember, high-quality compressions save lives. Good CPR includes proper compression depth, proper rate, full chest recoil, and minimal interruptions. Push hard, push fast, allow recoil, and rotate compressors when possible because fatigue reduces CPR quality quickly. Good EMTs constantly ask, are compressions effective? Are interruptions minimized? Is ventilation adequate? Is scene control maintained? Is ROSC occurring? Because cardiac arrest management requires teamwork, communication, and constant reassessment. One of the most important EMS concepts, early defibrillation, saves lives. The longer ventricular fibrillation continues, the lower the chance of survival becomes. That's why early CPR, early AED use, and rapid resuscitation matter so much during cardiac arrest. AEDs are one of the most important life-saving tools EMTs use because during sudden cardiac arrest, minutes matter. And understanding shockable rhythms, CPR quality, AED operation, and minimizing interruptions can absolutely save a patient's life. If this video helped, subscribe, because next in this resuscitation series, we're covering CPR mistakes EMT students make, sudden cardiac arrest recognition, pediatric resuscitation, and advanced airway considerations during cardiac arrest. And those are all major NREMT resuscitation topics.